Event-free survival has been used very frequently in our assessment of our clinical trials and the new interventions for AML. But it's always been controversial as an endpoint in this setting, which is interesting because in solid tumors, event-free survival is well established as a endpoint of value for patients. So the question is, or the way some people have viewed this question is whether event-free survival is a surrogate of overall survival, and the answer is not. Survival is one of the endpoints, or death is one of the endpoints that constitute an event for event-free survival. But there are other things. Relapse and not achieving a remission are other events for event-free survival. So does the patient benefit then from having a better event-free survival, even if they don't get a better overall survival? And we recently analyzed this question to see if you take patients that have the same survival, let's say two patients and they're both going to live 6 months, but one patient achieves a remission and stays in remission longer, then eventually relapses and finally dies by the 6 months, whereas the other patient doesn't get the remission or gets a very short remission, needs more treatments, and it's getting all of that. So they live the same amount of time, but one has a longer event-free survival. Is there benefit on that? So we analyzed what happens on these patients during those 6 months of their life. And what we found is that the patients that have a longer event-free survival tend to require fewer transfusions, tend to require fewer hospitalizations, tend to go less frequent to the emergency center. They require fewer laboratory tests, fewer x-rays, fewer consultations, etc. So they do require less interventions. So it's more valuable time that they spend as opposed to having to be getting more chemotherapy and getting infections and getting admitted to the hospital all the time. So I think that event-free survival is valuable by itself, independent of the overall survival. Of course, we want our patients to live longer, but we want them to live longer and better. It's not just a matter of extending life. And we see patients telling us that all the time. They don't want to just live a little longer. They want to make those days that they live count and feel good and not spend them in the hospital. So I think that event-free survival it has value. It has been accepted in very recently in the approval of gemtuzumab ozogamicin as a valid regulatory endpoint, which is something that I think I actually agree 100% with that approach in accepting that as a benefit for the patients.